Imagine this, every year, 15 million babies are born preterm, and complications from preterm birth are the leading cause of death among children under 5. Now, what if a simple mineral could help reduce this number? Delving into the hidden role of zinc in pregnancy, it's been suggested that low serum zinc levels might be linked to suboptimal pregnancy outcomes. These include prolonged labor, atonic postpartum hemorrhage, pregnancy-induced hypertension, preterm labor, and post-term pregnancies. However, many of these associations are yet to be firmly established. The primary objective of this study was to assess the effects of zinc supplementation during pregnancy on maternal, fetal, neonatal, and infant outcomes. Through rigorous randomized trials and data collection, researchers sought to uncover the truth about the role of zinc in pregnancy. This is not a story of a miracle cure, but rather, a tale of uncovering the subtle yet profound impacts of a single mineral on the complex process of pregnancy. So how did the researchers uncover the story of zinc? They embarked on a systematic review, a rigorous process that involves searching through numerous studies. In their quest for answers, the researchers turned to the Cochrane Pregnancy and Childbirth Group's Trials Register. A meticulous search was conducted, sifting through countless studies up until the end of October 2014. And as you can imagine, the reference lists of these retrieved studies were also scrutinized. But not all studies made the cut. The selection criteria were quite stringent. Only randomized trials of zinc supplementation during pregnancy were included. Quasi-randomized controlled trials, on the other hand, were left out. Once the relevant studies were selected, it was time for data collection and analysis. This required the combined efforts of 3 review authors. They applied the study selection criteria, assessed the quality of each trial, and extracted the necessary data. The quality of the evidence was evaluated using the GRADE approach, ensuring a high standard of analysis. In total, 21 randomized controlled trials were included, reported across 54 papers, and involving over 17,000 women and their babies. The trials were generally at a low risk of bias, indicating a high degree of reliability in the findings. This thorough process of systematic review allowed the researchers to draw conclusions based on a large body of evidence. With the data collected and analyzed, the story of zinc starts to take form. So, what did the researchers find? Does zinc play a starring role in the story of pregnancy? Let's dive in. The most significant finding was a small reduction in preterm birth associated with zinc supplementation. To put it in numbers, there was a 14% relative reduction in preterm birth. However, this wasn't accompanied by a similar reduction in numbers of babies with low birth weight, which is an interesting point to consider. When it comes to other primary maternal or neonatal outcomes, the findings were less clear. There were no significant differences between the zinc and no zinc groups for any of these outcomes, except for the induction of labor in a single trial. Moreover, no differing patterns were evident in the subgroups of women with low versus normal zinc and nutrition levels. The quality of the evidence was assessed using GRADE, a system that rates the quality of evidence in studies. The GRADE quality was moderate for preterm birth, small for gestational age and low birth weight, and low for stillbirth or neonatal death and birth weight. While zinc supplementation may not be the magic bullet for improving pregnancy outcomes, it does offer a 14% relative reduction in preterm birth, particularly among women of low income. The story of zinc in pregnancy isn't over. In fact, it's just beginning. The evidence suggests a slight reduction in preterm births with zinc supplementation, especially in low-income areas with high perinatal mortality rates. But the story doesn't stop there. The need for more comprehensive studies on overall nutrition, not just zinc, is crucial, particularly in impoverished regions. As we navigate this complex narrative, consider your own dietary choices and their potential impacts on your health. As the story of zinc and pregnancy continues to unfold, remember, every choice you make can be a step toward a healthier future.